Hi, I'm Dr. Jeff Hayward. I'm a family physician in North Toronto. I've spoken a lot about the benefits of EBMfer that provides 100 milligrams of elemental iron from Ferrous Ascorbate due to its superior absorption and tolerability in treating iron deficiency anemia. And in fact, we've seen studies that over 40% of the iron in EBMfer is actually absorbed. Today I'd like to talk briefly about EBMfer Plus and its utility as a prenatal supplement, daily vitamin supplement, iron maintenance, immunity support, and support for bone, skin, hair, and nails. Folate deficiency can cause birth defects like neural tube defects, certain congenital heart and urinary tract defects, oral facial clefts, and limb reduction anomalies. And these may be prevented with proper prenatal vitamin supplementation. So the SOGC recommends any woman aged 12 to 45 who can become pregnant should be advised by their healthcare provider to maintain a healthy folate-rich diet and undergo a brief periodic dietary review, and I'll talk specifically about their recommendations. The SOGC provides very specific recommendations for prenatal vitamin supplementation to ensure optimal maternal and fetal health. As you see on this chart, the majority of our patients are low-risk patients. And for these patients, they recommend a dose of at least 400 micrograms or 0.4 milligrams of folic acid daily to prevent neural tube defects, and a low dose of B12, as you see here, 2.6 micrograms to aid in fetal neurodevelopment. B12 is especially important in women that are vegans or vegetarians, but it's recommended across the spectrum of low, moderate, and high-risk groups. As you see here also, they give recommendation for the moderate-risk patient and the high-risk patient, but the majority of our patients will be low-risk patients. And as mentioned, they do also recommend an extra amount of B12 for these populations like vegetarians and vegans, patients with malabsorption conditions like celiac disease and inflammatory bowel disease. Also recommending iron, as we do in all women that are pregnant, for the prevention of maternal anemia, and we recommend 16 to 20 milligrams a day. Vitamin D to support fetal bone development at least 400 units a day, and calcium supplementation for individuals with low dietary calcium intake, as you see here, but ideally they should try and get it from their diet, and it's thought to reduce the risk of hypertensive disorders in pregnancy. I'd like to introduce once again EBMfer Plus, which is a vegan supplement containing 5 ingredients. As you see here, folic acid, iron, B12, vitamin D3, and zinc. It contains 45 milligrams of iron with built-in vitamin C from Ferrous Ascorbate to enhance absorption. Contains 1 milligram or 1,000 micrograms of folic acid or folate, 1,000 micrograms of B12, and 1,000 units of vitamin D3 and 10 milligrams of zinc. The iron source in EBMfer Plus is the same as what we've seen in EBMfer, which is Ferrous Ascorbate, a very highly absorbable and well-tolerated iron source that's combined with vitamin C as the salt. Although EBMfer contains 100 milligrams of iron, EBMfer Plus provides immunity support due to vitamin C, 1,000 units of D3, and 10 milligrams of zinc, and the amount of iron in it is a little bit less at 45 milligrams. Also, it provides bone, hair, skin, and nail support due to vitamin C and vitamin D3. EBMfer Plus can also be used as a daily vitamin and mineral supplement by providing adequate doses of required vitamins and minerals in a single, well-absorbed, well-tolerated capsule. And by combining 5 essential ingredients in one, it reduces pill burden. Once again, I'd like to emphasize that the iron source, Ferrous Ascorbate, is the same as what we've been using in EBMfer, although at a slightly lower dose, and the dose is 1 capsule a day with food. In summary, consider EBMfer Plus, a vegan daily supplement for your pregnant or planning to become pregnant patients. It can also be used for iron maintenance and immunity support. Thank you very much and have a good day.